When exercising my cardiac and pulmonary patients, what signs and symptoms should I be aware of? When it comes to the cardiopulmonary aspect of physical therapy, physical therapists must have a strong grasp on the potential signs and symptoms of a cardiopulmonary problem that their patients may present with. The ability of a physical therapist to recognize the most subtle signs and symptoms can prevent a major incident. With this population, often the most useful measure are a patient's vital signs. However, a patient's physical appearance and subjective perception of the session is important as well. Monitoring the patient's blood pressure, heart rate, and pulse oximetry prior to, after, and in high-risk patients during the exercise is the most objective way to measure how a patient is tolerating their treatment session. Important signs to watch for with this population include no change or drop in systolic blood pressure with activity, systolic blood pressure greater than 240 mm per mercury, diastolic blood pressure that increases greater than 20 mm per mercury with activity, a decrease or no change in heart rate with activity. However, a patient's medication should be taken into consideration, an increase in heart rate that is disproportional to the activity, and lastly, a drop in the patient's blood oxygen saturation to below 90%. Other signs of a cardiopulmonary problem include cyanosis, which is usually first apparent in the lips and fingers, extreme shortness of breath or shortness of breath disproportional to the activity, or a score of greater than 7 on the modified Borg scale of perceived exertion. Other signs and symptoms to be aware of include patients complaining of chest pains or chest palpitations, lightheadedness or dizziness, an unexplained increase in the patient's weight, calf pain, or sudden numbness or weakness. What are contraindications and precautions to therapy, and how should adverse reactions be handled? The cardiopulmonary population can be one of the most complex when it comes to contraindications and precautions. Many of the patients in this population that you will see will have multiple comorbidities and are often taking many different types of medication. Because of this, it is imperative that physical therapists know when therapy is contraindicated and what actions to take if their patients present with signs and symptoms that were discussed earlier. Absolute contraindications for physical therapy of the cardiopulmonary population include acute EKG changes, unstable angina, uncontrolled symptomatic cardiac arrhythmia, severe symptomatic aortic stenosis, symptomatic heart failure, pulmonary embolism, acute myocarditis or pericarditis, suspected or known aneurysm, or acute systemic infection. Relative contraindications or precautions for this population include coronary stenosis, moderate stenotic valvular heart disease, electrolyte abnormalities, hypertension greater than 200/110 at rest, tachycardia or bradycardia at rest, or high-degree heart block. Furthermore, many of the patients in this population are on anticoagulative therapies, so it is important to review the patient's INR, PT, or PTT prior to physical therapy to reduce the risk of bleeding. If a patient were to demonstrate any of the signs or symptoms discussed earlier, it is most likely that the exercise is too aggressive. Depending on the severity of the symptom, reducing the exercise intensity may be the solution. For example, if a patient's heart rate or blood pressure rises slightly above the desired value, backing down the intensity should alleviate the problem. However, if reducing the intensity does not work, or if a more severe symptom like chest pain or a drastic deviation in vitals were to arise, the exercise should be terminated immediately and the patient should be seated in a chair until symptoms resolve. In the case that the symptoms do not resolve, in the acute care setting, a physician should be consulted immediately. In the case of an outpatient setting, 911 should be called. By knowing the appropriate signs and symptoms to look for and the appropriate actions to take, you can feel confident in challenging your patients and watching them improve day by day.